Hi Internet. I think I wanted to qualify an earlier video. I don't know if you're able to do that on the internet. Are you? One video stands on its own and you live and die by that, I suppose, don't you? But I'm going to do it anyway. Hell. On the disorder stuff, I suppose I was speaking to what might be termed less severe disorder, which by and large more of the people I see and people who feel like they want a label, they want a name to tag onto something to explain stuff they find hard or difficult, right? And that sits apart from kind of more severe mental disorders that kind of sit further along the spectrum. Like I've worked with people on antipsychotic medication, people who've struggled with psychosis, and you can tell from the conversation that it's harder to have, and that there are other things going on which might be more kind of transparently termed disordered. Okay, and there are some sort of some sessions I believe in a sort of psychotherapy style that is kind of balanced two-way thing, like a kind of a normal sort of conversation where you give and take and you can ask questions, and you can receive questions and they're understood. Sometimes some clients, you can't really do that. You're a brick wall. You're there to be talked at, and you could be anyone or anything. They just care that there's someone in the room with them who appears to be listening and making the right noises. You can talk about the weather if you want, but it's not really psychotherapy in any sort of constructive, balanced kind of two-way style. And I suppose when you feel like that's happening, then you maybe have a sense that the disorder, if you still want to use that word, is maybe more kind of valid, but it still speaks to this idea of pathology, that there's something wrong, that could just be the way that the person is, and that again could be fine. There we go.